Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Angelica Film Center Mosaic in Fairfax, Virginia on Sunday, January 26th at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Love to talk to you. Give me a call, 888-630-9625. That's 888-630-9625. Any subject that you have on mind would be a good one to talk about today, because you probably have a problem or two that you've tried. You've applied all kinds of remedies and they've failed. Well, here's an opportunity. Let's figure it out without drugs, without surgery. I want to remind you, as you listen to this program, you listen to me lecture, you come to our office for our in-house continuing education programs, regardless of the subject, keep this very simple fact on the top of your gray matter. There's only 3 things that can cause anything. Either you've been injured in some way over time, either significantly like a trauma from a car accident, or you've fallen down and hit your head or whatever, or something mild. Maybe you've been sleeping on your stomach when your head turned to the side, or you're chewing gum all the time, or little things that irritate the body continuously, or biochemically. Anything that's outside of our bodies that shouldn't be inside our body. For example, things that you eat that you shouldn't really been eating. Okay, things that you absorb in from the environment, and alternatively, things that you should be putting in there that you don't get enough of. We live in a hot box called an electromagnetic field of Washington, D.C. You're constantly being irritated by that. And the third piece is stress, emotions. And the thing that we have to remember about that is that the body doesn't know the difference physiologically between something that happens to you from injury, something that's you insult your body with, or something that you think about. It's all the same. So you have to learn how to control those 3 pieces if you want to control your health. And in today's world, you are the captain of your ship. You must be the person who takes charge, who controls everything. We're going to talk about several subjects today. I'd love to talk about your things, but we're going to touch on several things. First thing I want to do is I want to talk a little bit about metabolic syndrome, because it really affects way too many people. What are we talking about? Potentially 3 out of every 5 people in this country are potentially in trouble relative to this situation. That's right. There's huge numbers of folks, right? So let's talk about it. It doesn't mean that everybody has it, but there's a lot of people that are susceptible to it. And metabolic syndrome used to be called Syndrome X or Dysmetabolic Syndrome X, and there's a lot of guidelines. But metabolic syndrome simply is a disorder of the body's ability to function normally, physiologically, the ability to store energy, the ability to maintain normal blood sugar levels. And so what does that have to do with anything? So let's talk about what that is. Metabolic syndrome, or cardiometabolic syndrome, or Syndrome X, or insulin resistance syndrome, has many different names, but it's all the same. What you start seeing with people is that you start seeing an increase in cholesterol, just gently starting to go up. Blood pressure starts sneaking up a little bit, and your blood sugar levels start sneaking up a little bit. So when you have all of those guys, coming around, and guess what? You've got a problem. And some authors will go on and say that there's other pieces to that puzzle as well, and you need to be aware of those pieces. So what are they? Well, we're talking about abdominal fat, central abdominal obesity. It's like if your belly is as big as your shoulders, or, even bigger than your shoulders, you got a problem. Elevated blood pressure, we talked about, blood sugar levels going up. You start seeing triglycerides. It's one of your lipids. It's one of your fats starting to sneak up. And then the good fats, the high-density lipotrophics, they start dropping like crazy. Metabolic syndrome increases the risk of developing many different things. Diabetes is one. Heart failure is another. Plugging of your arteries, we call cardiovascular disease. And that ain't something that we need to turn our head around for, because you know what? It's going to catch you, and you're going to drop in an instant. There was a statement that was released, not real recently, but within the last couple of years, of the International Diabetes Federation Task Force and the National Heart and Lung and Blood Institute, the American Heart Association, World Federation of, I think it's called the World Heart Federation, and it goes on. Anyway, they said the definition and the risks are very significant, and it doesn't leave anybody out. It doesn't leave anybody out relative to sex, whether you're male or female. It doesn't leave anybody out relative to ethnic group. Obviously, there are many people in the world across the board that this is a major problem for us. So the previous definition was kind of restrictive, but now they're getting their eyes open, and life as you know it can become very hazardous very, very, very quickly. So let's talk about it. What is the problem? And how do you know if you have it? How do you know if you're susceptible to this? Because all the things that I talked about are as a result of increase and also produce, is kind of a vicious loop, an increased inflammatory response in the body. So, but it's really the most pervasive problem in the United States. The ones that get it, we said 3 out of 5 potential. Well, 2 out of 5 really get it. Okay, the numbers grow larger every year because we're getting fatter and we're not watching what we eat. And you can be a fat, skinny person. That means that you don't have a lot of weight on your body, but your internal metabolism is loaded with fat. You got fat around the arteries, you got fat around the heart, you got fat around your organ systems. You go and you touch somebody who looks thin, but instead of having a dense muscle mass, they feel squishy, and that's not a good thing. So, according to the powers that be, if you will, the different professional associations, here's what it is. And this is not exclusive. So waist measurement, if you have a gut of 40 inches or greater in guys and 35 inches or greater in women, that's one of the indicators. Your triglyceride level starts creeping up. The guidelines are 150. My guidelines are about over 110 to 115 based on other parameters as well. Your good fats, your HDLs, drop below 40. And guys, that's about you, and women under 50. Blood pressure, if it starts sneaking up across that 135 mark on the top, which is your systolic pressure, and the bottom line starts creeping up about 85, you have an issue. Your blood sugar fasting level, they say, is 100 or higher. Dr. Tom says that anything above 95, you really, and it matches up with some of these other things, you got a problem. So let's talk about central issue, what metabolic syndrome really comes about and what it produces, and it's a blood sugar control problem. Now, one of my favorite programs on television is The Biggest Loser. And I watch it, and I try to kind of get in the middle of it because I don't like to go through all the beginning stages. I watch the beginning night because I like to hear what the people have to say, and then I like to see them as they begin to fold. And then I like to see the last few weeks as these people who have stood the test of time change their minds, change their ability to function, really take off at the highest levels possible. And it's more than just dropping weight. What does it have to do with? It has to do with the state of capacity of the gray matter between their earlobes. And when anybody, no matter who they are, changes the way they think and perceive things, not moving away from, that means I got to get rid of this fat, I got to get rid of this fat, I'm going to die, and you start thinking about, I want to be healthy, I want to be strong, I want to be buff, I want to be able to, to live to be, 100 years old with the greatest of health and mental clarity. That's a different mindset. And you can watch these people, and the ones that change their mindset, the ones that change what it is that they want out of life, really, and they identify with that, are the ones that will go the distance. They're the ones that are going to make it long term. The same thing. So why am I bringing that up? Because those folks, as you've seen if you watch them, they have diabetes, they have heart disease, they have all kinds of problems. They are metabolic patterns. And so when you look at yourself, you have to look at, are you a slug? You don't get up and move around. Are you under a tremendous amount of stress in your life? Everything that happens to you, you internalize and you make worse. Are you the type of person that, catch as catch can, and you think that diet really doesn't have a lot to do with anything? Well, guess what? You're headed for destruction sooner or later. Remember, you don't have to be big like the guys on The Biggest Loser. You can be a slender person that has a whole lot of fat and the body's breaking down under stress patterns. Inflammatory levels are going up. Why is inflammation so high? Because inflammation is brought about because of dietary indiscretions, injury patterns and pain that stay there that don't go away, and emotional stress. And then you start taking the medications that start going over and over the body like a pitchfork. They just, they're starting to poke holes in your body, and things start getting worse, and you start breaking down, and you wonder why your physician has to increase your medication or change your medication. Well, we're talking about that, and that's what it is. So when we're talking about blood sugars going up, blood pressure's going up, cholesterol's going up, triglycerides and so forth, and your body's getting fat relative to dimension. So, that 40 inches of fat around the waist, guys, guess what? It doesn't have to be 40 inches. It just means that your chest-waist measurement are off. So the central issue is control of inflammatory reaction throughout the body. So we talked a little bit about the causes and, the contributing factors, which means you're a slug and you don't do the things that you need to do and you stress like crazy. But you need to get control of all this, because if you don't, you're going to end up taking medication for hypertension and hardening of the arteries and fatty liver disease and systemic inflammation, and your kidneys are going to start shutting down because they're going to be damaged, and you're going to go into a high-raging diabetic situation, and all of a sudden you find yourself with your physician telling you have to take these medications for the rest of your life. I don't know about you, but that's not something I want for me. So is there a way out? Yeah, there's a way out. One of the reasons I wrote my book a couple of years ago, Ageless Health, Health as a Do-It-Yourself program, basically talks about the steps you need to take, but it starts with a decision. It starts with your brain doing what it's supposed to be doing. So metabolic syndrome is one that you can reverse completely. You can turn it around if you're willing to make a mental decision to change what it is you're doing. How many of you eat more carbohydrates in your diet than you do fresh vegetables and lean proteins? How many of you would rather grab a candy bar or a Snicker bar because you don't have time and get that with a cup of coffee or a soda? How many of you that the amount of exercise you get is grabbing the remote control, sitting back down in the chair and flicking through channels during the day, maybe walking back and forth from one room to the other? How many of you react instead of plan an attack on something, walk through it? How many of you pray or meditate on a daily basis to drop it down? You know what I'm talking about. If those things are all yes, 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 and yeses for you on the wrong side of the scale, I would encourage you that you need to do something very differently, because you're headed for disaster. You're headed for trouble. Why did I decide to talk about this and start off the program like this today? Simply because of the fact that, you reach a place in practice where you say, oh my God, aren't people getting it? And you see more and more people in this country, we're getting heavier and we're getting lazier and we're getting fatter. And a lot of it's due to technology. A lot of it's due to not taking responsibility for ourselves. A lot of it is a social hallucination, a social psychosis, as I talk about it, that, well, what do you expect for your age? And all of those things will do one thing for you. they're going to knock you down and they're going to eat you up, and you're going to end up with the heart diseases and the cancers and the loss of calcium substance from your bone and the things that make life miserable over a long period of time, when in fact you can turn them around. You can make things very different. You can change your body's capacity to heal. You can change your body's capacity to thrive and to be better than where you are today. As long as you're breathing, the body's forgiving, you can do something extremely different. When we come back after the break, we're going to talk about a couple other interesting things. We're going to take your questions because several of you are lining up. We're here at 888-630-9625. That's 888-630-9625. And we're going to talk about the 5 primary costs that are bankrupting the world, not only this country, but across the board. And one of them costs $150,000 a year just for the surgery. Like, it's ridiculous. So don't go away. We're going to talk about those. We're going to tell you how to avoid them. This is Dr. Tom Roselle. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625, 888-630-9625. That's how you find me here in studio. And if you'd like to talk to any of my docs or leave us a message, you can do it in 2 different ways. Go to rosellecare.com. That's ROSELLECARE.com. And or call us 703-698-7117. Tell my staff that you'd like to talk to one of my doctors, and they will get back to you. The fastest way to find me is through email. I answer it a couple times a week when it comes to the show, and I'll get back to you as quickly as I possibly can. Sometimes I'm traveling and it takes me a little longer, but I promise you that I will answer you at some point. Talking about several different things, and we're going to talk about a problem that can bankrupt not only your pocketbook but your employer's pocketbook. And if you have to go to surgery on this thing, just the surgical fee is about $150,000, and that's not including rehab and so forth. We're going to get back into that after the bottom of the hour and next half of the program, and we're going to tell you what your options are and how that all works. But in the meantime, there's several other things I want to talk to you about, but we want to talk about your thing. So let's go to the phones. Laura, thank you for holding and being patient. How can I help you?
Yeah, hi, Dr. Tom. Thank you for taking my call. I was listening yesterday on Maryland Public Television with a doctor. He's a neurologist, and he was talking about diabetes and how it causes dementia. So
True.
I wanted to know if this is true And also, he talked about cholesterol, and he said that it's good for you.
Well, Laura, just on the subject that we were talking about, and I'll answer your question because it's on topic of what we were just talking about. Number one, if you get a diabetic situation or even a pre-diabetic situation with the increase of blood sugars going high, your inflammation also increases, and what you have to know is that stops neurological transmission in the brain and in the nervous system throughout the body. So what you need to do is understand that when that happens is that you will lose your ability to think. You will lose your ability to process information as quickly and as effectively as you should. And there's a lot of vitamins that get destroyed and a lot of enzymes. NAC is one, the loss of coenzyme Q10, the circulation to the brain is impaired. So all those things that can open those up will be helpful. But the one thing that you want to do is do everything possible to decrease your body's blood sugar level, and not by taking things like metformin or insulin injections or things of that nature. You can do it by changing your diet, getting exercise, certain nutrients, making sure that things like chromium are at high enough levels and zinc are high enough levels and vitamin E are high enough levels in the body. Those things work. They work very, very effectively. So we can get on to that subject. I could tell you much more about it, but the short end is, yes, cholesterol is necessary because it makes your brain work. It keeps your hormones up. Too many people get their cholesterols way too low, and the doctor said, well, that's great. Well, it's not great because everything gets out of kilter that bit. Your liver is going to produce cholesterol. Your brain needs it. Your hormones need it. Other metabolic pathways need it. So I hope that's useful. Let's go to Bill. Bill, thank you for calling. I appreciate your phone call.
Thank you, Dr. Zell. I have a trigger finger, and I had a steroid shot in September, and it worked well till about December when it wore off, and now it's back. And I remember a couple of months ago you had said in one of your programs that there was an alternative. Don't ever get surgery for a trigger finger. There's something else you can do.
Yeah, once they cut you, they cut you. And, you're at that point, your ligaments and so forth are over elongated. What a trigger finger comes from, and I'm going to try to do this quickly because we're coming up to a break, is that the muscles that control the finger, and they start up in your forearm and they go all the way down, are not firing properly. Sometimes they're not firing properly because there's a pinched nerve in the neck or a nerve is being irritated in some way. So you have to make sure that everything is working. So a patient comes into our office and we look at it from if the wrist is working the way it's supposed to, we find out if the muscles are firing the way they're supposed to. We use the nutrient bases, we use acupuncture, and we try to make those things the primary focus. When we do, the body works, the fingers work, everything goes the way it's supposed to. Does that make sense to you, I hope?
Yes, it does.
Okay.
Is that the same number to contact you that I just called?
Yes, just give us a call. I appreciate your phone call, Bill. Thank you very much. We'll be right back after these important messages.
Dr. Tom Rosell Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Rosell. You're listening to Dr. Tom Rosell Live in studio, 888-630-9625. That's 888-630-9625. Several great pieces of information are out in the marketplace right now, and we're going to talk about one in just a second, and that's one of the things that are bankrupting our companies and are going to bankrupt your pocket, and there's an easy way to solve this thing and make sure that neither one of those things take place. But before we do that, we're going to go back to the phones. Frank, how can I help you? Thank you for calling.
Yeah, hey, Dr. Tom. You've talked about probiotics over the years, and so years ago, they started the deal, okay, well, we coat them. So now they go, your stomach acid doesn't kill them because supposedly your stomach acid kills most of them. Then they started, well, I've got the better one because I don't have 8 probiotics. I got 12 and 20, this, and this. Now they got them coated, and now they're like, okay, besides coating, we now have time release. What's the deal?
Good question. It's a question that's asked all the time, and the truth of it is that obviously you need the probiotics or the good guys in the gut. And when we do a very in-depth stool analysis to find out what lives inside of you, we look at the balance of probiotics, and we actually look at 9 of them, which are some of the most critical ones that maintain your immune function and maintain the intestinal system and so forth. But here's what happens. Many times you take all these great probiotics, and if you got a good company, they're organic based and they come in different substrates, meaning they're grown off of different things. Some of them are dairy, which I don't recommend because because there's too many people that have dairy sensitivities. Some of them are grown on soy. Another, challenge. But they're grown on many different things, and we have in the office several that we test for. But here's the deal: if the intestinal system doesn't have the good ingredients for it to begin to thrive on, what it does, it goes in and it'll kill some of the bad guys. It'll help balance out the mold and fungus, but it won't set in and begin to duplicate and grow. So you're taking them all the time. And in a perfect situation, you shouldn't have to take them for the rest of your life unless you get antibiotics and unless you get steroids and things that are going to destroy what's there. And unfortunately, way too often that occurs because in our society, in food manufacturing, they arbitrarily give the beef and the chickens and the turkeys and everything that you eat, they're giving them probiotics and steroids prophylactically, so that supposedly they don't have all the bugs. But meanwhile, you're getting the antibiotics, but it's killing your intestinal system. So what you have to do is you have to make sure that the body has enough something called prebiotics. And prebiotics are things that cause a fermentation process within the intestinal system that allows the good guys, what we call the microflora of the gut, to begin to work, to be able to grab a hold and start moving the way they're supposed to. A prebiotic is a non-digestible food form that gets into the digestive system and, as I said, helps the other stuff grow. And there's a lot of different things. They're very specific relative to nutrients. They're usually non-absorbable carbohydrates, like something called FOS, fructooligosaccharides, and it's a big name. Problem is that's a sugar, and if you have a problem with mold or fungus, that can flare it up. So there has to be levels. They're found in naturally occurring whole grains, but the good guys. You don't want to get the ones that are really high levels in gluten and so forth, so you have to work with somebody who can help you. Fruits and legumes, the beans, if you can tolerate things like black beans and so forth. Some people have poor digestive systems, so they can't break it up anyway. But many prebiotics are just good carbohydrates, but they're the good guys. So what do we mean by that? Well, FOS, for example, fructooligosaccharide, and something called inulin, which helps balance blood sugars as well. Natural sugars, they're found in bananas, but we don't want to have a lot of bananas because they convert to sugar too quickly. Some chicory root, onions, different types of onion, leeks. We talked about fruit, sweet potatoes, asparagus, and those guys will help you develop an environment where the probiotics can grow. Another source of prebiotics, things that I like, obviously, are things like endive and dandelion greens and radicchio and garlic. All of these things, serve your intestinal tract at a very high level, so the good guys, the probiotics, can get in there. So, if you have enough prebiotic supplementation, you're going to increase your levels of the good bacteria. They will actually get into the body and they'll start growing the way they're supposed to, and you increase your immune system dramatically. You reduce, obviously, the levels of bad guys because they can't live there anymore. You help absorbing minerals within the system. If you're prone to constipation, one of the things I tell patients to do all the time is to eat these things because it dramatically increases it. But you got to add water. You got to have a lot of water because otherwise the stuff will sit in there. Remember, I said it's not digestible like other things are. So does that help you? Does that make sense?
Yeah, it does. If you were going to use a probiotic, like you say, if you end up on a antibiotic for some reason,
yep,
then if it has the FOS in it, is that all right if you can deal with the FOS?
If you can deal with the FOS, yes. And not all probiotics work for everybody the same way simply because of the sensitivities and how they're formed.
Right.
So you have to be very careful. You have to look at the substrates. Only use organic products. Never use anything in a probiotic that is not organic. And you have to make sure that what they say is in it. So you want to get a laboratory that is reputable in that way. You can search them out. If you get to me privately, I can give you a couple, but I'm not going to tell you on air because they don't pay for the show.
Right.
But nevertheless, I take a probiotic on a routine basis, not necessarily every day, but I'll take one several times a week, and then I'll get off of them for a while. But I eat all this stuff, and my gut is really in pretty good shape when it comes to making sure that this stuff is able to implant and grow. Anyway, I hope that helps, Frank. And if I can help you in any way, just get a hold of me through our website at rosellecare.com, and I'll go back and forth with you.
I appreciate it.
Appreciate you. 888-630-9625. Let's talk about anything that you'd like to talk about. Let's go back to topic, and then we'll get back to your calls as well. There are 5 things that put the greatest amount of financial burden on our society globally, humanity globally. The first is ischemic heart disease. That means your blood vessels aren't doing the job. You're not getting the circulatory pattern to the heart muscle. The second is respiratory disease. The third is stroke. The fourth is diarrhea, believe it or not. And the fifth, and in this country probably one of the is the leading cause of disability worldwide, is low back pain. So if you got low back pain, you're in trouble. So the healthcare costs are taking, just the singular problem is taking your company, your insurances, your pocketbook into bankruptcy. And if you have to go to surgery, just the surgical cost is $150,000 on average, and if that's an uncomplicated situation. So here's the deal. If you have low back pain and you go see an orthopedist first, an orthopedic surgeon first, 42% of you will likely go to surgery. And of the 42% that go to surgery, there's a 50-50 chance that that surgery will be successful. That is the success rate for surgery. What does success mean? That means that you get better, or at least you don't progress and get worse. So there has to be another way. What's the other way? Well, those of you who went to a chiropractor first have a 1.5% chance of ultimately going to surgery. 1.5. That means that, the risk of having to have your back cut is so minor. I think I know where I would start. So if you want a 42% chance of having to have your back opened up, go see your orthopedist. If you want to avoid that surgery, you want to avoid that knife and get your life back, go see a chiropractor. Go to people that do what we do. The risk adjusted. Now, chiropractic care versus medical care is straight across the board. Now, we're not even talking, we're talking surgery. We're talking neurological surgery, orthopedic surgery. Is just about 20% of the cost of going to any of these other guys. 20%. So we can save 80% as a society. I think that would help bring down our deficit, don't you? 888-630-9625. Love to talk to you on whatever subject that you have in mind. We're going to talk about a couple other things. One of the things I want to get into, again, is GMO, genetically modified foods, and we're going to touch upon that today. But let's go to the phones first. Jake, how can I help you, sir?
Hello, Tom. What I called you about was to see if there's a non-surgical way to clear a blocked artery.
Where's the artery? And is it just one?
There's probably a couple of them. They're in the calf.
Okay, so it starts with, the short answer is yes, and it depends on how advanced it is. Obviously, the medical route from beginning to end is, vasodilators, and then they're going to give you blood thinners, and then the combination of those things, and they're going to give you compression stockings, and then they're going to say, when that doesn't work, you're going to do surgery. So you have to find out the why underneath all of that, how it started. And again, this is broad brush. That's not just simply about you. What was the diet? Was the patient a smoker? Was there any injury to the legs over time? Was there any previous surgery that collapsed the arteries and then began to cause the arteries to begin to, clog up and block? What's the overall metabolic pattern? And we talked about metabolic syndrome earlier, because that can enhance and increase the risk of this sort of thing. So the short answer, let's talk about pure plaquing. If it's a systemic plaquing situation, then you want to do things that will reverse the process. You have to change the diet 100% alkaline until you get to a place where your saliva is at 7.23 alkalinity. Then you can begin to go to an 80% 20% diet. 80% of your diet should be alkaline, 20% can be acidic, and you balance it. There are substances. There are chelators. There's oral EDTAs. It doesn't work as great as intravenous EDTA if somebody's very, very clogged up and they're a high-risk patient. We're going to send them to somebody who does IV EDTA to begin to pull that out. But at the same time, you have to give high levels of mineralization because the EDTA, the intravenous chelator, will also not only pull the plaquing out, but it's also going to pull the mineralization out of the bones and so forth. So you do it in conjunction with the right supplementation. If it's a collapse of an artery, it's a different story. Then it has to do with pressure. It has to do with a lot of other things. People have heart attacks that have nothing to do with plaquing. They have strokes that have nothing to do with plaquing. What it is the vessel itself collapses. And that has to do with a lot of different elements, but we could spend 3 programs talking about that. But the short answer is yes, there's a lot that can be done. Distilled water, but you want to do all of this stuff in conjunction with somebody who knows what they're doing. And you need to be evaluated. I'm being very broad brush right now because I don't know your particular situation. But if you'd like to go back and forth with me, send me a note, and then I'll tell you what I would think and what I would do if it was me.
This is probably plaquing.
If it is plaquing, then there's some people that you should see, but I need to know how advanced it is to tell you who to go see. So if you want to share that information with me, just get a hold of me at rosellecare.com, send me a note, remind me of our conversation, and then I'll give you the names of 2-3 guys that do this work.
Okay, thank you, sir.
You're welcome, Fred. Thanks for your phone call. 888-630-9625. We have several more calls. We're going to go back to the phones, but first I want to talk to you a little bit about frankenfoods. And what am I talking about? I'm talking about GMOs. Frankenfoods are basically, the modifications of our food sources by companies like Monsanto and their friends. And Monsanto is the major producer, and the FDA and other pro and anti-GMO individuals and groups continue to assert their position that this stuff isn't bad. Well, guess what? We got to step up to the plate and realize that we're being duped on a lot of different reasons, and the reasons that we're being duped is simply because of the fact that it puts money in somebody's pocket. In many industrialized countries, including, the good old US of A, there's very little genetic diversity within the food crop. And however, in countries and societies like China and Ethiopia and, over in the eastern areas, farmers that farm traditionally and have been doing so for a lot of years, actually mutating their crop outcomes by replanting the seeds. And, that's a natural way of changing things, but not by modifying intentionally the genetic pattern. Farmers have had methods of hybridization for years to increase the strength of something or make things a little pure and so forth. And let's take good old corn seed, which is one of the primary things that Monsanto likes to genetically modify. It's used in tortillas, and we can roast corn, and we can make popcorn out of it. And so we do things to make those things happen so that they're more easily processed. And what farmers have realized, by replanting the seeds from season to season, they can expect different crop outcomes based on that old genetic, pattern. So they take those seeds that produce certain things, and they do it again, and when they find that, they do it again. So pretty soon they have a purity, but that's a natural evolution. But when you get things like, Monsanto specifically deciding that they're going to change something, I'm going to divert just for a second. There was a program, and I can't remember when I saw it. I don't know if it was on YouTube or I was scanning something, but it was a show by our good old Dr. Oz, right? And he was interviewing a representative from Monsanto, and what Dr. Oz did, he expressed the concerns of cancer and other debilitation and safety to a representative of Monsanto, right? And I'm kind of paraphrasing what took place, but the guy from Monsanto said, we do not need any more studies to quantify and to qualify our foods. There are no problems, which told my brain, guess what? They ain't done any studies. There's none out there that support his position, not one. Go to the literature, look for yourself. It doesn't exist. We're coming up to a break. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. Been taking your phone calls at 888-630-9625. If you'd like to talk to us off the air, all you have to do is go to rosellecare.com, ROSELLECARE.com. And by the way, take a tour around. By the way, we just changed our web page, and those of you who are familiar with it, why don't you go in and take a look at it and see what it looks like, and send us a note. Tell us, just kind of go through the whole thing and click on different things and tell us whether you like it or not, and see if we have to modify it again. We're trying to do it for you, to give you information. If you go on, you're going to find all of our in-house continuing education programs, the old ones, and you can rent them. I think they're like $2, $1.99 just to cover the costs of producing these things. But they're there for you. They're on all kinds of different subjects. So help yourself and let us know what else you'd like to do. By the way, I'll give you the dates coming up, and they'll be posted on our website. Those of you who haven't seen the twice Emmy-nominated award PBS special, Ageless Health, we had it at the Angelica Film Center a week or two ago, and we're going to have it at the Bow Tie Theater in Reston in March. So go to our website probably sometime this week or so. It'll be posted there. So we'd love to have you. It's a fundraiser for caring for others. All money, all proceeds goes to caring for others. I will be at each one of these that are going to be done in the area. We're going to try to do them every couple months or so. But join us. I think you'll be very, very impressed. This program's way too short, unfortunately, and there's tons of you sitting on the phones right now, but I'm going to go to as many as I can. Fred, how can I help you?
Doctor, I had a ruptured disc a number of years ago, and I don't know whether to go to an orthopedic surgeon or a chiropractor, but because now I'm getting my feet are, the soles of my feet are getting kind of numb, yeah, and tingly. And I get a headache in my forehead. Just it's very localized to just specifically the forehead.
Yeah, unfortunately, it's way too common, Fred. What's happening is two things. Once you have surgery, you're cut, and you end up with scar tissue and adhesion.
No, I haven't had surgery.
Oh, you didn't? Okay,
no.
So you had a ruptured disc, but you didn't have the surgery.
Yes, sir.
Got it. Okay, thanks for clearing me up on that. So the same type of thing. Once that disc has begun to rupture through, you can either have a protruded, which is a bulging disc, or you can have a herniation, which is a ruptured disc. And that gets into the central canal, and it can impair spinal fluid flow. But those things usually come about because a misalignment in the structural system, putting an abnormal amount of pressure on the soft tissue. And then as you breathe and you have to pump the spinal fluid back and forth from the brain to the pelvis to the brain, that spinal fluid flow doesn't work the way it's supposed to. And I'm going to use an analogy. It gets dammed up. And that's where that pressure is. When you're walking around, that headache isn't as bad. But when you're laying down, you wake up in the morning, you have that heavy pressure in your head. That's the spinal fluid motion not working adequately. And to restore that, you've got to restore the structural function, get those things to work synchrony, and then also be able to reestablish and restore that motor unit, meaning the disc space that's in between two of the bones of the spine, and much can be resolved. But it has to do with structural chemical balance. If the vertebrae out of line and the dietary patterns aren't good, what'll happen, unfortunately, it'll get progressively worse. But there's something that can be done naturally called spinal decompression that will reduce that. Fred, I'm sorry, I can't continue. We're coming up to the end of the program, and unfortunately, that's the way it is. You're listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon. Make sure you join us next week and tell your friends about the program as well. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.